This is day one on the job for one of the youngest and first Indigenous president of the Canadian Medical Association. Dr. Alika Lafontaine says Canada's healthcare system is in crisis and that he wants to advocate for a national standard for medicine that will be consistent across all regions. Dr. Lafontaine also wants to advocate for marginalized voices in healthcare and plans to draw on his Indigenous identity while working on solutions to a range of problems. Well, this comes as Canada's healthcare system continues to deal with staffing shortages, long wait times, and growing mental health concerns among medical professionals. Well, joining us now to tell us how he plans to tackle a system in crisis is Dr. Alika Lafontaine himself. Sir, welcome to Forum Daily.
Thanks for having me.
Now, I know adding a voice to marginalized communities is a priority of yours. So, as the first Indigenous president of the CMA, how do you plan to draw on your heritage as well as your lived experience as a physician in Alberta to help address the barriers that Indigenous communities and other marginalized communities continue to face in healthcare?
Anytime that you have a new voice around a table that hasn't been there before, there's an opportunity to really learn from their lived experience. We're in the midst of crisis in the mainstream healthcare system, but there's a long history of dealing with crisis in Indigenous communities across the country. And so we can bring in those learnings. We can take the principles that we know work from those decades of experience, focusing on the people who actually are affected, making sure that the people actually provide the care, provided the support, and making sure that we track where our resources go so we can make sure that the things that we think we're solving, we're actually solving in the course of trying to change healthcare.
And we know you're advocating for a national standard for medicine in Canada. So, what would that standard look like across the country?
So I think the word standard encompasses a lot of different approaches. So each of the provinces has their own approach to registration for health professionals. Each province has their own approach to the different rules that govern practice. They all have their different approaches to health and human resource management and the way that they define primary care within each province. And so, depending on whether you live in Quebec or whether you live in British Columbia, those can look very, very different across the country. I think what we've learned in this pandemic is that there are certain things that make sense when you decentralize, and there's other things that make a whole lot of sense to centralize. And going through the discussion of finding out which things we can adopt across the country so we truly do become a Canadian healthcare system instead of siloed territorial and provincial health systems is something that's well worth discussing and that could lead to a lot of solutions to the problems that we face.
And turning to some of the key issues facing healthcare right now, staffing shortages are continuing to affect Canada's healthcare system. So, what steps are you pushing for officials to take to help grow Canada's medical teams, bring in more doctors, and keep the
Mhm.
ones that are already there?
So there are immediate things that could be done. The first focus of any government should really be ensuring retention of the people who work right now. And that can come in the form of different incentives. Some of those are related to money, other things are related to working conditions. But the second big part is making sure to have space to actually provide that high quality care that we all wanted to provide when we first came into medicine. One of the most satisfying parts of being an anesthesiologist, which is my own specialty, is connecting with patients and having them have a good experience from the very beginning of when they meet me to the end. And right now in the healthcare system, there's not a lot of space for that because we're so focused on doing things at the lowest cost at the highest volume. The third part is finally actually getting to that team based care that we talk about. Every time that we talk about team based care, it seems in recent news, we talk about replacement of one type of provider for another. For example, there's not enough family physicians, so who can replace family physicians? When in reality, if we drop the barriers of people mobilizing across the country to different parts, if we drop the barriers and create national approaches to things like virtual care, we can all lift where we stand and provide an environment for patients to get the best care where we all do what we do well.
All right, doctor, just about a minute left here. But after speaking to a lot of physicians and medical professionals on the show, we find that mental health is a huge concern within that environment. So, how should officials address the issue of mental health among medical professionals as well?
Well, we definitely know that mental health has gotten worse for providers across the country in the past few years. Many people are deciding to leave practice or scale back the amount of time that they spend in healthcare. If there is one thing that we can get across is that mental health issues are a result of poor working environments. The stresses that you experience, you never recover when you go home and then come back to work again. We have a lot of health professionals who can't actually remember, an easy day at work. Every time you come in, you catastrophize another horrible thing that can happen. And I imagine for patients, having providers constantly on edge, worried about what might happen to their patients, doesn't lead to a good patient experience. So, really doubling down on creating that space to provide an excellent patient experience and providing good working environments. I think that's the best way to address mental health in the health system right now.
All right, lots to keep our eyes out for at the CMA. Doctor, again, thank you for joining us today on Forum Daily.
Thanks for having me.
Stay with us. When we come back after the break, we look at the major headlines and news stories from around the world as Russia blames Ukraine for a deadly car bombing. That story and more up next.